Let's get to the heart of a matter affecting your health. May is American Stroke Month, a time to take stock of the dangers of an issue affecting people across the country. The CDC says every 40 seconds, someone in the U.S. has a stroke. That's when something blocks the blood supply to part of the brain or when a blood vessel in the brain bursts. And 1 in every 6 deaths from cardiovascular disease is caused by a stroke. And despite what you may think, it's not just affecting older people. Experts say the same contributing factors you see in adults are becoming more common in younger patients. Things like high blood pressure, cholesterol, and stress. 23-year-old Ann Falk was folding laundry when her body went numb.
Half of my body was totally immobilized on the left side, and on my right side, it felt like as if I was having a seizure that was uncontrollable. And then I also had a very severe migraine in my head as well.
Ann's friend called 911, and because of her quick thinking, Ann's in recovery and doing well. Others aren't always as lucky, and the numbers are rising. Look at this. The CDC shows a sharp jump in stroke-related hospitalizations for people under 45 years old. It's up nearly 15% in the last decade. So you have this critical issue harming younger and older people alike. We decided to bring in an expert to discuss. Please welcome Dr. Karen Olds, neurologist with St. Luke's Health System. Thank you so much for being here. We know strokes are largely preventable and treatable. What's leading to this rise in hospitalizations?
Well, I think we still have our traditional risk factors for stroke with high blood pressure, diabetes, and high cholesterol. But younger populations also have a higher risk of stroke for other states. We always go the extra mile to look for a different etiology in a young person, especially if it's a large vessel stroke. Where there's a clot in a large artery in the brain. Then we look for things like a congenital heart issue, dissections, or injuries to the carotid arteries or the vertebral arteries. Estrogen, high estrogen states in younger people, pregnancy, oral contraceptives with estrogen can also increase risk of stroke in younger folks.
Yeah, it's commonly taught the warning signs for stroke, right, with the acronym FAST, right? If you notice face drooping, arm weakness, speech trouble, it's time to call 911. Are there different signs or different things that younger people should be looking for?
You know, I do think it's important for younger folks that are suffering from migraine headaches, especially with an aura or with kind of neurologic symptoms that go along with that other than just the head pain itself. I do think that should be taken into account in younger folks and older folks, but definitely younger folks with strokes.
Are signs different for men versus women?
Not usually. They talk about signs for heart disease or heart attack in women are different than men, but in strokes, it's really the unilateral symptomatology with the facial droop, speech problems, vision loss, things like that.
I guess the biggest question kind of in the news you can use category is what should people do to try and prevent stroke?
Well, that's important. I think it's important to know what vascular risk factors are and then to know your personal vascular risk factors. We see people going into their 40s and 50s that haven't seen doctors in years. They really don't know how their blood pressure runs. They don't feel badly, so they don't get it checked out. So most importantly is to know the risk factors and know your personal risk factors and work closely with the primary care provider to minimize those.
All right. We know strokes can lead to lifelong disabilities for patients. I can imagine that especially affects younger patients and even their treatment plans.
Yes, it certainly does. Younger folks, also develop more health-related anxiety and depression and things like that following strokes and other things that can lead to disabilities. And obviously, the younger you are, the more that takes out of being able to do what you want to do.
Mm-hmm. Well, we appreciate your time. Dr. Karen Olds with St. Luke's. Thank you so much. To read up on the best ways to prevent a stroke and to learn more about American Stroke Month, go online to stroke.org.